Crohn's disease is a disease where parts of the digestive tract become inflamed. It usually involves the lower end of the small intestine and the beginning of the large intestine. It can also occur in any part of the digestive system, from the mouth to the end of the rectum. Crohn's disease is a form of inflammatory bowel disease. Also, ulcerative colitis is related to the condition. Crohn's also occurs when your body immune system mistakenly attacks and destroys healthy body tissue. When parts of the digestive tract remain swollen or inflamed, the walls of the intestines become thickened. Some key factors to Crohn's disease include your genes and family environmental factors, smoking, and how your body to overreact to normal bacteria in the intestines. Crohn normally occurs in people between the ages of 15 and 35. Main symptoms of Crohn's are crampy pain in the abdomen, fever, fatigue, loss of appetite, and weight loss. Watery diarrhea, which may be bloody, and the feeling that you need to pass stool, but your bowels are already empty. Some other symptoms include constipation, sores or swelling in your eyes, draining of pus, mucus, or stool from around the rectum or your anus, joint pain and swelling mouth ulcers, rectal bleeding and bloody stools, swollen gums, and tender red bumps under the skin. A physical exam may show a mass or tenderness in the abdomen, skin rash, swollen joints, or mouth ulcers. Some tests to diagnose Crohn's disease are barium enema or upper GI series, colonoscopy or sigmoidoscopy, CAT scan of the abdomen, capsule endoscopy, MRI of the abdomen, and enteroscopy. The disease can alter the results of low albumin level, high SID rate, fecal fat, low blood count, abnormal liver blood tests, high white blood cell count, and elevated fecal calprotectin level in stool. Some ways to manage Crohn's disease at home is with diet and nutrition. You should eat a well-balanced, healthy diet, including enough calories, protein, and nutrients from a variety of food groups. Some food can make you have diarrhea or really bad gas. To help relieve some of these symptoms, you should eat small amount of food throughout the day. Drink a lot of water, avoiding high fat foods, avoiding fatty, greasy, fried foods, and sauces. Limited dairy products if you have problems digesting dairy fats, and avoid food that you know that can cause gas, such as beans and vegetables in the cabbage family. You can also ask your doctor for extra vitamins and minerals, such as iron supplements, calcium, and vitamin D supplements, and vitamin B12 to prevent anemia. Medications to help treat diarrhea is Imodium. You can also use fiber supplements, Metamucil and Citrusel, and acetaminophen for pain. Avoid using aspirin, ibuprofen, or naproxen. It could make your symptoms worse. Your doctor could prescribe you aminosalicylate to help control the mild to moderate symptoms. It can be given orally or rectally. Corticosteroids to treat moderate to severe symptoms. Antibiotics to treat abscesses or fistulas. Immunosuppressants drugs such as Iuran to avoid using long-term use of corticosteroids. Surgeries that can be done is ileostomy, removal of part of the large bowel or small bowel, removal of the large intestine to the rectum, and removal of the large intestine and most of the rectum. If you have an ileostomy, you need to learn to diet changes, how to change your pouch, and how to care for your stoma. You may feel embarrassed or depressed about having a bowel disease. There is no cure for Crohn's disease, but there are support groups to help with overcoming the disease. If you have a severe Crohn's, you may have an abscess or an infection in the intestines, anemia, bowel blockage, fistulas in the bladder, skin, or vagina, slow growth in children, swelling of joints, problems with maintaining a healthy weight, and swelling of the bile ducts. If you have a bad abdominal pain, can't control diarrhea, weight loss, has a fever that lasts more than 2 to 3 days, has nausea and vomiting, skin sores that do not heal, and has joint pain and that prevents you from everyday activities, you need to go see your doctor. Monitor the patient's vital signs and temp. Monitors patient's skin, weight, intake, and how many bowel movements per day. Also monitor the patient's psychological status to see how depressed they are. A nursing diagnosis would be diarrhea related to inflammatory process.